Paris Demetriades, journalist at Digital Tree, for a Fireside discussion on end-of-life care in a pandemic and post-pandemic period. Barry.
Καλησπέρα και από μένα. Συγχαρητήρια για την ιδιαίτερα ενδιαφέρουσα φετινή διοργάνωση του Cyprus Forum. Η επόμενη συζήτηση θα πραγματοποιηθεί στα αγγλικά, καθώς έχουμε τη χαρά να φιλοξενούμε σήμερα μια τουρκοκύπρια ακαδημαϊκό με πραγματικά πολύ σπουδαίο και αξιόλογο ερευνητικό έργο. Mrs. Dr. Hocaoglu, it's a pleasure having you with us today.
My pleasure, Paris. Thank you for the wonderful introduction, and good afternoon to all from a very dark and rainy London. I wish I was there with you.
Yes, I'm sure about that, at least for the weather. I need to say a few things about you before we deep into a discussion about your current work. Dr. Mevhibe Hocaoglu is very respectable, I must say, interdisciplinary academic research coming both from a humanities and hard sciences background. She's currently a research associate on the so-called palliative care. She will explain us in detail what is this about at the King's College in London. She specifically holds a PhD degree from the University of Reading, where she developed and tested the first quality of life instrument for persons living with Huntington's disease. She holds a Master of Science in Public Health from the University of Oxford. She went through both anthropology and biology in the past, and nowadays she's working in a very important, current, and innovative research related with the so-called palliative and end-of-life care treatment, aiming to offer a better quality of life for patients and their families suffering from serious life-limiting illnesses and their families, including COVID-19. Mrs. Dr. Hocaoglu, you are originally from Cyprus, aren't you?
Definitely, yes.
So, how would you personally define the medical term palliative care?
That is a very good question, Paris. Thank you for asking it, because the term palliative care is often found to be very complex. It's often only associated with people who are dying. But I've come across a definition of palliative care that has stayed with me, which is that palliative care is the kind of care that you would like a person that you love who is seriously ill to receive. So what kind of care would you like a person that you love who has received this serious illness, diagnosis of a serious illness, to receive? You would like their symptoms to be very well controlled. You would like their family to be very supported. You would like the patient to be heard. And you would like, most of all, for them to have and maintain and have improved quality of life. So this is what it is. This is, I think, a very good definition of palliative care. That palliative care is about the person. It's person-centered. It is a holistic approach. It uses holistic approach. It incorporates the views of the patient, their preferences, their values, their goals into their care. And it is delivered by a multidisciplinary or interdisciplinary team And this team may include chaplains who deliver spiritual care. It includes clinical staff, nurses, as well as doctors who treat and give medical care. It could include social workers. It could include rehabilitation specialists. So it includes quite a number of different disciplines in its delivery. So I just need to emphasize that palliative care is a medical specialty as well as a nursing specialty. So it is a very important medical and nursing specialist service. So it could be delivered in a hospital, in a very highly technological palliative care unit, just like intensive care units, or it could be delivered at a person's home or a care home. So it is holistic care delivered by medical and nursing specialty staff, including social care, rehabilitation specialists, that could take place in a number of settings outside the hospital. It could take place in a hospice, it could take place in a hospital. So I hope that gives you a good definition for palliative care.
That's definitely a very good and broad definition. If I may ask, what made you personally interested in this new medical term?
Thanks for the question, Paris. So, of course, working in a field, you tend to be personally attached and also intellectually attached to it. So I have grown up in Cyprus in a healthcare family and friends, among friends. So my father, Dr. Halim of Limassol, was a surgeon. Sister Cemaliye Hassan of Paphos was my mother, who was a matron. Later, the boss of my dad as the director of health and medical medicine. We grew up with at the hospital. We grew up with talking and hearing about people dying, people being injured, even people recovering. So I think personally, I'm very inclined to be and very attached and very familiar with health and being in health care surroundings. But after, I think it was when I was a teenager, having lost my father to a heart attack, and later when I'm a younger adult, my mother developing dementia, actually reintroduced the importance of healthcare and also emphasized, kind of stirred this passion of working with, incurable illnesses or working with families who have, who suffer bereavement. At the age of 15, when I lost my dad, I think I must have suffered more than 5-6 years. So when somebody dies, when somebody is diagnosed with a critical illness, you have, more than one person, their friends, their families being affected. So I think personally, these experiences have, I think, maybe motivated me to be working in palliative care. Maybe because I wanted to learn how to better cope myself, as well as maybe support others to better cope with the diagnosis of a critical illness. Critical illness, or what we call life-limiting illnesses, are, reality. It happens to everyone. Some people are born with a life-limiting illness from birth. Some develop it later as an early adult, an early onset disease like Huntington's disease, a horrific disease. And it is something that will never go away. We are currently living in a world where people usually have more than one condition that they are dealing with. They are multimorbid. There are people who are, suffering, who are quite deprived from minority ethnic groups, hard to reach populations, so with added on complexities. So you can no longer just focus on the disease, but you have to focus on a person as a whole. And I think personally and intellectually, the challenge of, this complex issue of coping, of improving life, quality of life, when cure is not an option, is something that has personally, intellectually, has motivated me to be working in palliative care.
Other than the patients, the aim is to help their families as well, isn't it?
Definitely, Paris. We always think of or I would say conventional medicine thinks of a person who is healthy, they become ill, and they focus on the illness. We in palliative care tend to think of a person before their illness, at the point of their diagnosis, all throughout until their death and after death. So palliative care is about, well, it could potentially begin before symptoms. So for example, if you have someone who is carrying the gene for, or gene mutation for Huntington's disease, I think its impact on their life begins before the onset of the symptoms, because Huntington's disease is a disease that, that kind of is pre-symptomatic for a long time, and then the symptoms emerge when people are at their most, prime of their life, at early adulthood. So the moment the talk of a life-limiting illness enters a family, that's when palliative care should begin. And during the illness, of course, it continues and complements and supports alongside the usual care. Palliative care knows quite a lot about death and what we call good death, in making a person live until they die, until, as Sissy Saunders, who's the founder of the modern hospice movement, emphasizes. And it is also about, after death, the families that are left behind, who they should be cared for as well. But of course, a patient or a person does not exist in a society on their own. They have families, they have friends, they have people who are very important to them. So why don't we include them in the care of the patient? Of course, the patient is always at the center. But what happens if somebody is admitted and is unconscious, like a COVID patient? Who would know what the patient's preferences would have been if the patient were able to talk, other than a family member or a friend or someone who knows them really well? So you have to include patients, their families, their friends in care, and that's what palliative care is about.
As far as I know, there are units in the hospitals in the UK and in the US, but not in countries like Cyprus. I think there are not units in most of the countries of the world. Isn't that true?
Very true. Palliative care, as I said, could be delivered, in specialist units. Of course, the higher income countries tend to have them. They're called palliative care units. But for example, our team at King's College Hospital and Sissy Saunders Institute, where I work at, our team is not palliative care unit based. So it basically goes into oncology ward, it goes into children's ward, it goes into orthopedics, renal. So wherever the patient is, the team kind of goes to them. So it is quite, very rare for services to have palliative care specialist units. Of course, that is the best kind of care. But and also care does not only take place in a hospital. So you have to have your community teams, which are very important. And I think Cyprus, both north and south of the Green Line, the cancer societies, does quite a lot in delivering palliative care at home. And that is also very important. So it is not really necessary to say, palliative care needs to be in a hospital. It actually can be at different settings. And usually patients and their families may prefer to be at home rather than in a hospital.
Do you have any plans in the next few months that might involve Cyprus as well?
Definitely, Paris. Always. Cyprus is always with me and in my ideas. But joking aside, I have had the honor of receiving a Fulbright Visiting Scholar Award, supported by my mentor, Professor Higginson, and another mentor based at Harvard Medical School, Professor Eric Kroger, and together we would be replicating what we have been doing in the UK, basically setting up an outcomes action collaborative. So it would be wonderful if civil society organizations, anyone interested in palliative care, would join us in kind of setting up a collaborative between the US, UK, and Cyprus in supporting, good quality data collection, patient-centered data collection, in order to capture palliative care activity, no matter what level of activity there is, including costs, in order to, of course, inform better care. We have been here with a project led by Professor Higginson, my boss. We have been implementing this model as part of South London NIHR supported project, and it is really making a huge change. So at the Institute, we have a palliative outcome scale, and so we are trying to support and introduce the measurement of patient-centered outcomes using this measure. And I hope that in the next few months, where my placement will begin at Harvard Medical School, I would be able to talk and get in touch with your colleagues at Cyprus Forum in general and all across Cyprus. Thank you.
We're looking forward to it. Unfortunately, we're running out of time. As you know, it was a very short intervention for today's event. It was an honor having you with us today. Thanks a lot. I wish you all the best with your research, and hopefully we will be able to meet soon in person as well. Thanks for being with us today.
Thank you so much for inviting me. Good afternoon.